Hello, everyone. Today, we're diving into a vital topic that influences almost every aspect of our health: metabolic health and insulin resistance. In recent years, insulin resistance and metabolic health have become some of the most talked about topics in the health community. With metabolic-related diseases like type 2 diabetes, cardiovascular disease, and obesity on the rise globally, understanding how we can improve our metabolic health has never been more important. In the next 10 minutes, we'll explore what metabolic health truly means, why insulin resistance plays such a crucial role, and the latest research-based guidelines on how to improve and maintain our metabolic health. By the end, you'll have practical strategies and a deeper understanding of why metabolic health is foundational to a long, active, and fulfilling life. What is metabolic health? Let's start by defining metabolic health. According to current guidelines, metabolic health refers to having optimal levels of blood sugar, triglycerides, HDL cholesterol, blood pressure, and waist circumference without the use of medications. The key is that these markers need to be balanced for the body to function well, providing energy while minimizing disease risk. Unfortunately, recent studies show that less than 12% of American adults are metabolically healthy, a concerning statistic when we consider how this impacts long-term wellness. Poor metabolic health increases risks for chronic diseases, cognitive decline, and even some cancers. The role of insulin and insulin resistance. Central to metabolic health is insulin, a hormone that helps control blood sugar by facilitating glucose entry into cells for energy. Insulin resistance occurs when cells in the body become less responsive to insulin, making it harder for glucose to enter cells. In response, the body produces more insulin to try and compensate, which can lead to high insulin levels, often undetectable without blood tests. Over time, this can result in elevated blood sugar, increased fat storage, and ultimately, type 2 diabetes if left unchecked. Research has consistently shown that insulin resistance is at the root of metabolic syndrome, a cluster of conditions like high blood pressure, high blood sugar, and abnormal cholesterol levels. The American Diabetes Association and the CDC have highlighted insulin resistance as a primary target for prevention and intervention. Risk factors and symptoms of insulin resistance. One of the challenges is that insulin resistance can be asymptomatic in its early stages. However, certain risk factors increase the likelihood, including poor diet, particularly high sugar and refined carbohydrate intake, lack of physical activity, excess body weight, especially around the abdomen, chronic stress, and poor sleep. People with insulin resistance might experience symptoms like fatigue after meals, strong sugar cravings, increased hunger, and weight gain, particularly around the abdomen. Dark patches of skin, called acanthosis nigricans, around the neck or armpits can also be a sign of insulin resistance. Why metabolic health matters. The impact on long-term wellness. Improving metabolic health means more than just preventing disease. It's about increasing daily energy, mental clarity, and resilience against various health conditions. Studies from Harvard Medical School emphasize that even minor improvements in metabolic health markers can reduce the risk of cardiovascular disease by nearly 40%. Improved metabolic health is also associated with better mental health, as balanced blood sugar helps prevent mood swings, fatigue, and the mental fog associated with poor glucose regulation. Guidelines and evidence-based strategies for improving metabolic health. Now, let's move into the actionable part of this talk. What can we do to improve our metabolic health and reduce insulin resistance? We'll discuss 5 primary areas, each backed by guidelines and evidence-based findings. Adopt a balanced, low glycemic diet. The food we eat plays a significant role in insulin sensitivity. The American Diabetes Association recommends a diet rich in whole foods, with an emphasis on low glycemic, high fiber options. Studies indicate that foods high in fiber, like vegetables, whole grains, legumes, and lean proteins, help regulate blood sugar levels and prevent spikes in insulin. Avoiding refined sugars and carbohydrates. Processed carbs like white bread, pastries, and sugary beverages cause rapid blood sugar spikes, which can worsen insulin resistance. Adding healthy fats and proteins. Incorporating healthy fats, like those in avocados, nuts, and olive oil, and proteins helps slow glucose absorption, reducing blood sugar spikes and improving insulin sensitivity. Engage in regular physical activity. Exercise is one of the most powerful tools for improving insulin sensitivity. The American Heart Association recommends at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity weekly, plus strength training. This helps muscles absorb glucose more effectively, even without insulin. High-intensity interval training, HIIT. Studies show that HIIT, which involves short bursts of intense exercise followed by rest, significantly improves insulin sensitivity and metabolic markers. Strength training. Building muscle through weightlifting or resistance exercises also enhances glucose uptake. According to a study in diabetes care, combining strength training with aerobic exercise yields the best results for insulin sensitivity. Prioritize quality sleep. Sleep directly impacts insulin sensitivity and blood sugar levels. The National Sleep Foundation recommends 7-9 hours of quality sleep for adults, and studies show that poor sleep increases cortisol, the stress hormone that raises blood sugar levels and promotes insulin resistance. Sleep hygiene. Implementing a regular sleep schedule, avoiding screens before bed, and creating a relaxing nighttime routine can improve sleep quality. Chronic sleep deprivation has been linked to metabolic dysfunction, so addressing sleep is crucial for insulin sensitivity. Manage stress and practice mindful relaxation techniques. Chronic stress elevates cortisol, which, when persistently high, promotes insulin resistance and fat storage. Techniques like meditation, deep breathing, and mindfulness have been shown to lower cortisol levels and improve metabolic markers. Mindfulness practices. Research in psychoneuroendocrinology found that just 10 minutes of daily meditation can significantly reduce cortisol levels, supporting metabolic health. Breathwork and exercise. Incorporating breathing exercises or yoga into your routine can effectively manage stress and its impact on metabolism. Stay consistently hydrated. Hydration is fundamental for metabolic processes. Dehydration can raise blood sugar levels and decrease insulin sensitivity. The Institute of Medicine recommends around 2.7 liters of water per day for women and 3.7 liters for men, including water from foods. Electrolytes. Adding electrolyte-rich beverages, especially post-exercise, supports hydration and aids glucose metabolism. Avoid sugary sports drinks. Instead, opt for options like coconut water or DIY electrolyte mixes. Emerging research and long-term benefits. Emerging research is exploring additional ways to improve metabolic health. For example, studies on intermittent fasting have shown promising results, with certain fasting patterns helping to regulate insulin and glucose levels. Additionally, research into the gut microbiome suggests that the diversity of gut bacteria may influence metabolic health and insulin sensitivity. The benefits of improving metabolic health are clear and impactful. Studies from the Journal of the American Medical Association show that those who manage to improve insulin sensitivity can reduce their risk of type 2 diabetes by up to 58%. Not only does this extend to physical health, but it also impacts mental well-being, with improved mood, energy, and cognitive clarity. Conclusion and key takeaways. To wrap up, let's review the key takeaways on improving metabolic health. Adopt a balanced, whole food, low glycemic diet with plenty of fiber, lean proteins, and healthy fats. Incorporate regular exercise, including a mix of aerobic and strength training, to enhance insulin sensitivity. Prioritize sleep as an essential component of metabolic health. Manage stress with mindfulness, meditation, or other relaxation techniques to lower cortisol and improve glucose control. Stay hydrated to support cellular function and blood sugar regulation. Improving metabolic health is a journey, but even small changes can lead to big health outcomes. By making these adjustments to diet, exercise, sleep, stress management, and hydration, you'll be taking proactive steps toward a healthier, more resilient body. Thank you for watching, and I hope this talk has empowered you with knowledge to make informed decisions for your metabolic health. Remember, each step counts in building a healthier, happier you. Thank you for joining us today. Please subscribe to PulseCheck for more evidence-based health insights, and let's continue this journey to optimal health together.